Hello class, this is Jeffrey and I will be talking about the drug Risperidone as a pharmacotherapy for treating post-traumatic stress disorder. Alright, let's begin. Risperidone, with the brand name Risperdal, is an atypical antipsychotic medication first approved for use in the United States by the FDA in 1993. And at this time, the FDA approved the use of oral risperidone as the method of administration in the form of tablets, oral solutions, and MTABs. MTABs are quick absorbing tabs that will dissolve in your mouth. The initial FDA approval was to include the treatment of schizophrenia in adults and adolescents ages 13 and up, Bipolar I, acute manic, or mixed episodes as a monotherapy in adults, children ages 10 and up. Bipolar I, acute manic, or mixed episodes as an adjunctive with lithium or valproate in adults only, and also to treat autism-associated irritability in children ages 5 and up. Now the drug is approved to be administered through injection as a longer-acting therapy, but this method of administration has only been approved by the FDA right now for adults. And off-label uses for risperidone include the treatment of psychotic symptoms from illnesses or disorders like borderline personality, delusion disorder, delirium, depression, brain injury, pedophilia, post-traumatic stress disorder, bipolar disorder, conduct disorder, Tourette syndrome, trichotillomania, which is a disorder where you have the urge to pull out your hair, stuttering, movement disorders, and developmental disorders. And I looked into a bit of the research on treating using risperidone for post-traumatic stress disorder, and we're going to look at that a bit today in a case study. So moving into some side effects. Significant adverse effects include weight changes, metabolic changes, and sedation. Risperidone may also produce extrapyramidal symptoms, including acute dystonia, akathisia, tardive dyskinesia, and Parkinsonian features, which can include skeletal muscle rigidity, tremor, and bradykinesia. So although these side effects are thought to be reversible, the duration of Parkinsonian features after discontinuation of the medicine can vary, and tardive dyskinesia will likely persist after the medication is discontinued and maybe even permanent. There are some noted serious side effects, which can include neuroepileptic malignant syndrome, which is a syndrome that can develop from using antipsychotics. And it's a life-threatening condition that can manifest in altered mental status, fever, and lead to rigidity and automatic instability, including hypertension and tachycardia. Also, the use of risperidone has been linked to higher probability of cerebrovascular events in elderly patients with dementia. Maybe it's not recommended for elderly patients with dementia. So now for some contraindications. Risperidone should not be given if there's a known allergy to risperidone or hypersensitivity to paliperidone, which is the metabolite of risperidone. Another one is it should be given to hallucinogen persisting perception disorder, HPPD, because this can cause panic and visual symptoms of hallucinations to intensify. So they should definitely avoid this drug as well. So there's mixed results in the clinical trials for risperidone as a treatment for PTSD. And so the clinical trials have shown effectiveness for psychotic symptom reduction relating to PTSD for these patients. And psychotic symptoms reduction such as that can be seen in hyperarousal, re-experiencing avoidance, nightmares, and flashbacks. The same goes for evidence from another study of women with similar diagnosis of PTSD with these psychotic symptoms from domestic abuse and sexual abuse. However, the VA has done 2 long-term studies now and concluded that risperidone was not effective for these patients who are non-responders or partial responders to antidepressants. And the APA, as of 2019, also suggests there's insufficient evidence to recommend using risperidone as a monotherapy treatment for PTSD. So there's a lot of literature out there on it, and definitely mixed results. I guess it's the clinician's discretion and the doctor's discretion for recommending this based on the client's symptoms, and if they're responders or non-responders to other drug therapies as well. All right, moving into my case example. So today we're going to be looking at Luke. He's a 27-year-old Caucasian male with a bachelor's degree from West Point Academy. Patient served 4 years in the United States Army as an officer. He retired as a captain and recently returned home from a combat deployment, his last one before retiring. He has been diagnosed with post-traumatic stress disorder, and his family advised him to seek outpatient mental health services. The patient reported vivid flashbacks and constant thoughts of a single firefight where 2 soldiers and a civilian child were killed. This scene continues while he's awake and in constant nightmares multiple times a week. The patient also reports that these flashbacks and nightmares are accompanied by head pain, sweating, nausea, and trembling, and has recalled several times now of hallucinating and seeing the civilian child that was killed staring at him at his bedside. His wife reported that he screams in his sleep almost every night, which he does not always recall doing the next day. And she also reports that he is angry most days of the week and notices when he is calm, he's often zoning out, aloof, and then he catches himself and he doesn't know what really, he's like disoriented. And his wife says that seems that he's stuck in his own head. She also reports that he has an increased alcohol consumption since his return home. The patient's medical history is remarkable for the diagnosis of PTSD, and the patient also has high blood pressure and frequent headaches and infrequent migraines. The patient is a heavy consumer of alcohol, averaging 2 to 5 drinks on any occasion, almost daily, and it has been recorded that he is not a responder to SSRIs for post-traumatic stress disorder symptom reduction. Luke reports that he is currently unemployed as he begins his transition out of the U.S. Army, and he is currently living in Massachusetts with his wife and his 3-year-old son. The patient reports no suicidal ideation and no substance use besides alcohol. The patient is participating in Mandatory Transition Assistance Program, or TAP, for soldiers transitioning out of the Army, which contains multiple mandatory online counselings and virtual trainings aimed to support his transition into civilian life. And he reports that this is the only structured activity each day for the last month. Luke was prescribed a low-dose Risperidone at 0.5 milligrams per day to see if this would help with his hallucinations, because he reported that he is terrified of the hallucination of the child, and it has shown reduction in symptoms of hyperarousal, re-experiencing nightmares, flashbacks, and the hallucinations. So it's working for him. And Luke has reported with this significant weight gain, fatigue, somnolence, and hypersalivation. So he's not happy with these side effects. And with the Risperidone treatment as drug therapy for the last 6 months, he had been participating in an intensive outpatient CBT program and has been giving it his all and working real hard. And he is sick of the side effects and he wants to stop taking it because the side effects are killing him. His psychiatrist evaluates him and agrees, and due to his progress and commitment to therapy, he wants Luke to continue therapy, so as they wean off the drugs. So Luke is now 12 months into psychotherapy and is no longer taking Risperidone, and the intensity, frequency, and duration of the PTSD symptoms have successfully and significantly decreased. So here we got a success story, and everyone seems to be happier in Luke's family, and he wants to continue with treatment because he's seeing how effective CBT is. He is not, however, upset at all for taking Risperidone because it helped almost immediately, and he's very happy with that too. And even though it has some bad side effects, it worked for him, and it's all about the long term. And he sees that, and it's been a year now, and he's doing much better. And we all love a success story. All right, this concludes my presentation. Thank you for those that chose to watch mine. I'm very excited to watch yours and comment. I'm excited to also see the comments that you post about this one. And it's been a great class. Thanks for everybody, and have a great one. Bye now.